Hello, my name is John Howard, and welcome to my YouTube channel. And today I'd like to talk to you about piercings. Piercings that may cause the pathology itself, or might be causing you just some problems when you're trying to treat the patient, such as you might be wondering if you should leave that piercing in or maybe take it out. An example would be if your patient had some really expensive diamond earrings in their lobes, you might want to be really careful and kind of leave them in if you can work around them. Because if they take them out and they lose them, and it could be just a family heirloom or it could be expensive diamonds, you don't want to cause any problems with your patients, especially when they're so tied to those piercings or even earrings. So today I'd like to talk to you about not only which ones to leave in or take out, but what some of those piercings could be causing. As you see by the name of the title of this presentation, there's a possibility of that, yes, some of these piercings might be causing either your patient from conceiving or preventing them from conceiving. So let's begin. So what I'd like to do first to give you the whole understanding of this concept is talk about the ear itself as an illusion. When some people look at the ear, they're just looking at it as just an appendage off the side of their head, but it really plays more than that. It's not for sound or anything like that. And if you ever take any biology courses, or specifically, I shouldn't even say biology, Terry Olson's course, he talks about that ears are only found in warm-blooded mammals. If you look at the desert fox, you'll see they have very large ears, and anything that lives up in the Arctic has very small ears. This is because that's how they generate and release heat from their body. So let's take a look at the ear, what it means as an illusion. So an illusion means something that you think is there, but it's really not. It doesn't exist. It's an illusion. It's kind of like a magic trick, something that can be to appear to deceive you. So to better understand this, I'm going to show you a couple pictures and take a look at them. We're going to look at them for about 5 seconds, and then I'm going to go to the next page, and you tell me what you think that picture was of, and we can see if we can get them all right. And maybe some of them have multiple meanings or pictures. Here we go. We're going to have 5 seconds to look at each picture, and then we're going to move to the next page. And here goes the first picture. What do you see here? Well, maybe you might have saw two people sitting in a hallway to an entrance. Or maybe you saw a drawing of two old people. Which one did you see? It could be anything, but when you first look at that picture right there, you might have not have seen there was more than one meaning to this picture. But now that we're looking at them, maybe you can see that. Okay, let's go on to the next one. It's going to be the same thing. We're going to take 5 seconds and look at it. Okay, did you look at it? All right, let's talk about this. What is it? What did you think you saw? Was it a duck, a bird, possibly a rabbit? If you look at it, don't look at what you think is the bill. That's the ears of a rabbit. So this picture here is of a rabbit. And this is the last one, and this is for the guys. You thought you saw something that really wasn't there. But you see how if you look at something right off the bat, you can think that it's something that it's really not. And that's what you see a lot when you look at someone's ear. And if you look at the ear specifically, it kind of looks like a little fetus or a baby in the wound of his mother. And that's why you get into this whole quantum thing. The part contains the whole, and you can treat parts of the ear that treat the whole body. So, okay. I want you to take a look at this picture here. You don't need to know this. This is of the phases from Paul Noget's invention of auricular therapy. This was later on in his invention. But if you look at it, it just talks about acute, chronic, and degenerate. And they refer to them as phases. The state of the disease is called a phase. You don't need to know what these mean, but just take a look at this picture. Memorize it, because you're going to see it again. All right, let's begin. So let's talk about Shinmen. Well, first, is this where you would find Shinmen? I know some people are like, wait a second, is that it? Maybe a little lower, a little higher. Don't get confused by that. It's pretty close, okay? It's 1/3 of the way up on the superior tragus fossa inside the tragus fossa. I get it. Some people put it up a little higher and put it a little bit lower, but don't get confused by that. But tell me some of the conditions. Well, actually, say in your head, because this is recording, what you would treat your patients with Shinmen. What kind of conditions would they have? Think about that. We all use it. Some people use it every day on their patients. So let's look at a a website from Australia about a practitioner down there who treats his patient with Shinmin. Let's see what they say about using Shinmin and how it works. Take a close look at this. Okay, here it is. Here's the patient. It's ear, and this is from the website down in Australia, and it's called Shinmin, the ultimate chill out point. And as you can see, I have a green arrow pointing to that piece of tape in the ear right there. I believe that's a tack in there. I really can't see, but it kind of looks like a little round spot, so it looks like a tack. And he talks about this patient, and the patient actually gives an interview about how she feels. All right, so this is what the acupuncturist says about Shinmin. He talks about how it's an amazing point for people who overthink, who are worried or anxious. And if you use it, he says his patients feel much calmer after they have it. So he's treating this patient here that you see her right ear. And this is what she says. I'm not going to read the whole thing, but she basically says, she tends to worry a lot. She's anxious, and when she gets to piercing afterwards, she feels more relaxed because she has a very busy life. And I'm sure this is nothing new that most of you have used Shinmin, have heard your patients say. And even if you're doing body acupuncture at the end, you can just throw Shinmin in, either a tack like you see here, or maybe even a seed when they go home to kind of maybe press on it to kind of stimulate it when they're feeling a little stressed. I'm sure you've either done this or heard about this. So let's take a closer look in on this. So before the patient came in, she would say these words on the left of your screen. Symptoms before the treatment. She said the word anxious three times: overthink, stressed, worried, or worried. And in post-treatment, she said those things. She feels more centered, calmer, mellowed, and relaxed. So you see the pre and post treatment symptoms that the patient described from the Shinmin. So now let's examine Shinmin here. So is this the correct location of Shinmin? I know some of you are going to be really nitpicking, but trust me, you don't need to. It's a simple yes or no. Remember the game Simon Says? Well, this is kind of a little bit like that too. Here's what I mean. The correct location of Shinmin. On the previous page, I showed you Shinmin. Depending how you look at the ear, remember now we're talking about quantum. I'll explain on the following page here what I mean by quantum and Shinmin. So on your left, you have what's called Shinmin, heart 7, and on the right, you have what's called ear Shinmin. Remember I said, is this the correct location for Shinmin? The Simon Says, Simon says, put your hands on your head, or then you just put your hand on your head. There's a difference between Shinmin and ear Shinmin. If you look at Shinmin on the body, it's heart 7, which is representative on the ear on the left, which would be way in the triangle, right in the fossa of the ear, towards what's known as Darwin's tubercle. It has the black circle. And on the picture on the right would be ear Shinmin, which is what you all learned in school. But did you notice one thing on that patient? In her Shinmin point, as you see here, she had a piercing. Very interesting. Now, I'm not going to get into piercings too much with gold and silver in this video. I'll talk about it in my next video, but most patients who have piercings in that part of the ear are usually silver. And silver in some modalities of acupuncture is a suppressant or a reducer, or gold as a tonifier. So you see. So let's move on. So this is what I'm talking about. So on the left side of the screen, you're seeing heart 7, or known as Shinmin. On the right side, you're seeing ear Shinmin. Maybe that point that patient had, that piercing, was doing something. Maybe she was treating herself at some innate level to treat herself for anxiety. But the problem arises where when you pierce the point, you destroy the point. And maybe it was working for a short time, or maybe a long time. But after a while, energetically, the point gets disturbed. So maybe that piercing was working for some time before she got acupuncture. And then when she went in, she received acupuncture from the acupuncturist. But there's more to this than meets the eye. Let me explain. So let's go quantum. Ready? So I talked about this point, Shinmen, ear Shinmen. So now after my explanation about where Shinmen's located, you'll see that the wrist point on the ear is projected right where heart 7 would be on the body, so we call that Shinmen. And on the left ear screen, it would be ear Shinmen. But is that point also something else? Think about it. Name to yourself or anybody's around you a body point that you would use besides ear Shinmen or body Shinmen, heart 7. What part on the body, what other point on the body would you use for relaxation, or anything you would use specifically that you would treat Shinmen with? What's another point you can substitute ear Shinmen or body Shinmen with? Think about it. You got it? So this point right here, besides Shinmen, it's called something else. Yin Tang. So not only is that point Shinmen, but when you go quantum, it becomes Yin Tang. Sorry, I thought I fixed that. As you can see, remember that photo that I showed you? It appears again. And if we move further on, you'll see that the point on the wrist, the Yin Tang, and heart 7 are all the same thing. Did you see that? It's there. So that's what I mean by going quantum. So we had to go through this little exercise to bring us to where I want to show you now. And that was just a quick trickery of the mind. So you get your mind in the proper place to accept and see the piercings now. So some years ago, I had a few patients come in, specifically in one day. And one girl in particular came in with shoulder pain, and she had a problem with the shoulder, and she had a specific piercing. And I thought, well, that's really interesting. And to be quite honest with you, I couldn't get a word in edgewise. She spoke very quickly. So as she was speaking, I just evaluated her ear and looked at it. And I thought, that's really interesting, because the pathology she's complaining about, the piercing runs through that. So I'm thinking that's probably part of the problem. So finally, after about 10 or 15 minutes, after she was done speaking, she said to me, "Can you help me?" And I just said, "No." So she got upset, and I told her, "I can help you, but you have to help yourself by taking this specific piercing out, because it's actually in the spot or the location that I would use a needle in to treat your pathology. It was specifically the shoulder pain." And she said to me, "It's funny you say this, because a few months back I had an MRI. And the only time I didn't have the shoulder pain is when I was in the MRI." And she thought it was because I had to stay perfectly still. But in reality, she thought about it. She said, "They did make me take out my piercing." So that's interesting. So this piercing also plays another function or another role. Along with that patient, that same day, I saw two other patients who came in who didn't have shoulder pain, but they were having a hard time conceiving or getting pregnant. And this is where this piercing comes in, not only for shoulder pain, which I was originally going to talk about, but actually possibly to prevent the conception. I'm not saying it's a great form of birth control, because I wouldn't try it, but I can tell you that even today, when I see patients come in who are having a hard time conceiving, when I see that piercing, I tell them to take it out, and usually they'll find another acupuncturist who specializes in infertility issues. I don't treat them, and they usually conceive if that's the problem, if it's the piercing. So let me discuss what I'm talking about here. So here is an ear with locations of piercings in their names. We all know the lobe. Some of the other ones are the tragus points and the rook and the date piercing, and you even got one called the helix. But the one we're talking about today is called the industrial bar. We'll talk a little bit more about the location of the industrial bar here in a little bit. But as you see, it goes from transverse, it goes from anterior to posterior, depending on how you look at it. And usually if your patient has just one or two piercings, it's usually a little lower. You'll see what I mean here in a second. You see this here? The other picture actually had the piercing going a little bit higher up. But if you look at this piercing, it looks like an arrow, kind of like Cupid's arrow, maybe. I thought that was interesting. Okay, let's begin. So if you look at the trajectory of the ear on the right and versus the ear on the left, you can see that the shoulder is not too far off. And depending on the piercer who does it, it might be right in the shoulder point. such as my patient was. It was on a much more of a degree of an angle. So you see this right here. But let's take a look at what it means if it's not for shoulder pain. Let's talk about if your patients are using this possibly as a form of birth control but don't know it. Or you might treat a patient who wants to conceive but she can't. I'll show you why, possibly. A clinical observation, that's all this is. Let's begin. So there's a book out there called Ear Acupuncture by Britta Strittmatter. And Beata Strittmatter wrote a book some years ago, and it's right here, and it's on the work based on Frank Barr. Frank Barr was a student of Dr. Paul Noget back in the early 70s, and he went back to Germany, and he kind of created the German style of auricular therapy. He took a lot of what Noget did, and he kind of added to it. So one of the things that Barr did is that in the 90s, he projected how the meridians would look if you were going to project them onto the ear. I'm not exactly sure how he did it, but him and his colleagues were able to do it, and they were able to come up with all the meridians on the ear. So let's take a look at what he did here, some of his work. But before we do that, actually, let's take a look at this book. If you have it, you know what I'm talking about. It's Peter Denman's book on acupuncture, a manual on acupuncture. Or if you don't, at least maybe some of you might have had it in the past, or at least know what I'm talking about. So one of the points that Denman talks about is Ren 5, or Stone Gate. And he talks about this in a philosophical way. And he talks about how if you pierce that point on the lower abdominal area, Ren 5, it can cause infertility for life. And as you can see right here, I'll just talk a little slowly about about the point, how it works. But what I found today when I was putting this PowerPoint presentation together today was this point is not known as Juyin. And when I thought about it, I Googled it, and something interesting came up. Very interesting we're going to talk about here. But anyway, move on. So here's Barr's meridians that he mapped, and if you can see, they're very small, but I will blow the ones we're going to show you. You see the meridians, there's 12 of them. The one that I'm pointing to in the red arrow on the bottom is the Ren Mao, or the Ren meridian, conception vessel. And on page 314 of Strittmatter's book, you'll see this is the Ren projected onto the ear. Now, in my PDF that I put on my website, I talk about the ASP needle. And I'm going to briefly discuss it here because it kind of touches the topic we're going on here. Because earlier I said, you remember, if you look at the piercings, they're always silver. In my PDF that I put on our website, I talked about the ASP needle, or the golden ASP needle, and what it represents. Remember, silver is the tonifying, reduction, where gold is tonifying. And if you use a gold ASP, you're balancing, you're not tonifying, you're reducing. That makes sense? Think about it. If you're using gold, you're tonifying. You're not reducing or tonifying, you're balancing. It's a trickery again. See, underneath that gold is the stainless steel. So you have gold and stainless steel, or yin and yang. It balances itself out. So when you look at the needle, you're thinking, oh, it's just gold, so this is going to tonify, or this is silver, and it really does reduce. But a gold needle is not pure 100% gold, or at least ASPs are not. Underneath that layer of gold is the stainless steel. Gold and silver, yin and yang, okay? So let's take a look at this here a little more deeply. And this is the gold ASP needle I was talking about. I measured that one day, and I noticed that it came to a perfect, well, almost perfect 5 ratio. Now you remember, the piercing we're looking at from Strittmatter's book is on page 314. Just move the decimal point a little bit over, 2 spots. Yeah, 314. Interesting. But no one ever gets an industrial bar that's gold that I usually see. So maybe that's something to think about. Okay, let's look at where the Ren is projected onto the ear, specifically Ren 5, Stone Gate. You see it? It's number 5 up on the top, up by the superior crus of the triangle fossa. It's right where that little hook is. It's right above the 6 on the right side of the screen. Now, let's talk about where that piercing is located. Look at the one on the right. You see it? Let's first discuss the one on the right. Look at the industrial bar. It's right at that level where the superior crus is. Now, if you look at the photo on the left, that piercing is way superior of the superior crus, and that little black dotted line represents that. So if your patient comes in and you see it there, it may not be causing a problem with conception. It may not be. Just because they have the piercing doesn't mean that it's going to cause that issue, or it might energetically cause that issue. It has to be in that specific location. Let's move on. And as you see, this patient right here is a lot different from the one that you just saw on the left side of the screen. The arrow is coming out right at the superior crus of the triangle fossa, right where Ren 5 would be. And we all know Ren 5 as stone gate. Now, today when I was looking this up, I Googled this, and this is what came up on Google. Here's side by side. Actually, I apologize. It didn't show up. But let me explain to you what came up today. Today, when I searched the word Juyin on Google, a sword came up, piercing the sky sword, or Juyin Jiao. And I thought that was very interesting because the first word that they talk about is piercing the sky. And we're talking about piercings of ASP, piercing of the point on the ear. And my last slide is Noget's phases. Phase means a condition of the disease. But if you look at the blue, the chronic, the stomach is a really big point on the upper helix of the ear there, this ascending helix. As you can see, that where the superior crus is, it's kind of like the lower stomach, kind of where Ren 5 would be located. And that piercing goes right through that area there. So if your patients are coming in and they have shoulder pain, look at the industrial bar or any piercings that are in the shoulder region. If your patients are coming in that are complaining that they can't conceive or get pregnant, look at the location if they have an industrial bar. If your patients are coming in that don't complain of that and you see the industrial bar, make sure if you take it out or tell them to take it out, make sure they put it back in, because that might be energetically their form of birth control. Because I've seen this. Does it work? Well, I've seen some crazy things out there, and I can't make a really great diagnosis decision because it's energetic medicine. But I can tell you this much: I think at some level it may be preventing them from getting or conceiving or getting pregnant. So I hope you enjoyed this, and look forward to my next video on piercings and tattoos and what tattoos mean on the body, and piercings that go along that matches those tattoos. Thank you.